Hi there, this is Renee, your clinical practice educator, and I want to talk to you for a minute about early warning signs for clinical deterioration. Now, you may or may not have seen these before, posted up on your unit or online, but what it is a list of things that we want to watch for in a patient that could indicate that they are getting into trouble and that we need to call for help. Things such as, a heart rate greater than 120, systolic blood pressure less than 90, SATs not responding to oxygen or maybe continuing to deteriorate, signs of sepsis, and so on. And I want you to think about this list as pieces of a puzzle. One thing on that list being present in your patient doesn't necessarily mean that they're in trouble. And I'm going to give you an example. So let's say you have a patient with a fever and also their heart rate is greater than 125. Now that high heart rate is likely caused by that fever. You can give Tylenol, you can phone the physician and maybe get a fluid bolus for that person. And those symptoms are probably going to start resolving and improving with those interventions. Alternately, if you have that same patient who is also now a bit confused, their blood pressure is low, they're looking pale, I'm a lot more worried about that patient because they're showing a lot more of those signs from the list. So you want to use the early warning signs criteria as a way to, put together pieces of the puzzle. And I think you'll find it a lot more useful and helpful in that way. And certainly if you find that your person that you're caring for has a lot of those factors in place, consider contacting CCOT and requesting help to help assess your situation, communicate with the physician, and figure out what's best for this patient and where they need to go.